smoking cessation is an important part of COPD management. Are there any additional management tools for COPD patients?
Yes, and I will review management of stable COPD. So once COPD has been diagnosed, effective management should be based on the individualized assessment of current symptoms and future risk. And you'll want to reduce the symptoms by treating the symptoms and improving exercise tolerance and health status. And then you'll want to reduce the risk by preventing disease progression, preventing exacerbations, and reducing the risk of mortality. Okay, so non-pharmacological management of COPD is categorized according to individualized assessment of symptoms and exacerbation risk. Ms. Tubbs is in the patient group B. The essential, recommended, and local guidelines for her include smoking cessation, pulmonary rehab, physical activity, and the flu vaccine, and the pneumonia vaccine. So there are some medications that she can use, the pharmacological treatments. There's a nice little chart in that gold packet that I given you earlier, and it gives a nice table of pharmacological therapy for stable COPD, and you would group your patient based off of their health status and the severity of their COPD, and it will give you a recommended first choice type of medication, an alternate choice, and other possible treatments.
Okay.
So Ms. Tubbs falls in the patient group B, and so the recommended first choice would be a long-acting anticholinergic or a long-acting beta agonist. So, for example, we would use a Spiriva is the brand name. The tiotropium is the class name. And it controls the symptoms by relaxing the smooth muscles around the airways, so it keeps the lungs open, makes it easier for them to breathe. That medication is used once daily. It's 18 mcgs, and it's a capsule that is crushed. So it's like a DPI. And then an alternative choice with her would be a Combivent. So that's the brand name. Another name for it is the ipratropium and albuterol. So it's a combination of two medications. It also relaxes the smooth muscles and keeps the airways open, but it combines the two medications with the dosage being a 20 mcg and 100.
Okay.
Okay. Now, Lucy, do you have any questions for me at all?
No, you've been very thorough.
Okay.
Thank you so much for helping me learn more about the role of the respiratory therapist in smoking cessation and COPD management. I'm looking forward to the rest of the day with you.
Okay, perfect. You're very welcome.